This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
All right, we'll see if this works. I was just going to talk about, I had a case that was kind of interesting recently. I think I'd spoken about this a few months ago, so I apologize if anybody was here. But I think we're starting to see a little bit more of this. But is anybody familiar with Kratom, or do you know what that is? All right, just show of hands. I'm just kind of curious. I mean, it's not very well known, so maybe less than half. Oh, sorry, you were here the other. Heather was with me at SWIR the other day when we talked about it, so she gets to hear my recycled medical minutes. So, but in any case, we had a patient who came in and was kind of being worked up as an outpatient for new onset liver failure, and not really sure why. I mean, it was all pretty acute, like within like the last week that before she'd come in, but just wasn't feeling well. Some right upper quadrant pain, nausea, vomiting, those kind of things, and then found to have elevated liver enzymes in the hundreds, and bilirubin was up to like between 5 and 7. Hepatitis panel all came back negative, and her doctor just kind of said, "Well, I've been drinking much," and it sounds like and she did have more drinks than she was used to, but it wasn't all that much alcohol, if that makes sense. And certainly it's a consideration, but the pattern of the liver enzymes didn't really fit. So we're kind of looking at everything else that might be a consideration with that, and anything happened before that. And she was taking for a few days Kratom, which she got from her boyfriend for some like headaches or some kind of pain she was having. And that's about the only unusual thing we have. So for those who aren't familiar, Kratom is something that you can buy at a lot of like head shops. You can order it online. Some states have banned it, not Colorado. Most states haven't. But it's basically comes up from a crushed up leaf from Southeast Asia. The tree is called Kratom, and that's where the name comes from. There's a lot of other names, but they're kind of harder to pronounce. And in the U.S., pretty much most people use the word Kratom. So it's Kratom if anyone's curious. The way people take it is usually just this pill form, or you can get these leaves. I think you could smoke it. I don't think people really do that. Some people make a tea out of it. If you get higher and higher doses, it gets pretty nauseating. And so, unfortunately, people who are trying to get high with this will actually make like a slurry. And there's been some rectal tube passages, to get that slurry use. So you bypass the GI tract that way. In any case, what it is this leaf that has kind of at low dose effects. It's almost more like a stimulant. So the workers in Southeast Asia kind of historically would just take this leaf and chew it up while they're working, kind of like in South America, people take the cocoa leaves and get a little kind of boost throughout the day, and probably not all that much different from us drinking coffee or caffeine of various sources anyways. But at higher doses, it does have to have more opioid-like effects. It does affect on the opioid receptors. So a lot of people do use it for pain and kind of get like a legal type high off of it. You do have to take a fair amount to kind of get those effects, but then you can also start to get some psychogenic properties where people are kind of hallucinating or kind of a little bit more of an agitated delirium type picture. So it's not a great drug, to be honest. It's got a lot of mixed properties to it, and there's definitely been some liver toxicity cases that have come from it. The other very interesting thing about it is that in the end of 2016, the DEA had made it a drug of concern, quote unquote, and they were about to kind of put some restriction or ban or make it a Schedule 2 or higher. And then just due to public outcry, and I'm sure somebody with political connections, the DEA kind of backed off. And so it's just kind of in this in limbo period where nobody knows exactly what to do with it. Some states kind of went and banned it on their own, but pretty easy to order online. My understanding, I don't think you even have to go on the dark web or use bitcoins or anything like that. You can just kind of go to your local head shop, and I think it's pretty readily available. So I suspect we're going to see a lot more problems with it in the future, because I think a lot of people just think, oh, it's a legal high, I can take it, and no harm done because it's not illegal. So I suspect we'll see more. But anyways, that's it.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.